For patients that deal with rosacea, it is without a doubt one of the most frustrating conditions. Hey everyone, I'm Dr. Dustin. I'm a board-certified dermatologist, and today we're going to be covering everything you need to know about rosacea. We're going to cover the 3 different types. We're going to talk about the triggers for rosacea and even some potential treatments, because I know that this impacts your quality of life if you have to deal with this on a day-to-day basis. And I want to provide you with the most information available to treat it over the counter with some product recommendations, but also what are your options if you go to see a board-certified dermatologist. So let's dive in. First off, what the heck is rosacea? Rosacea is an inflammatory skin condition. It is not autoimmune, but there can be a multitude of different causes for it. In the dermatology clinic, we break it down into 3 main types of rosacea, and the first one is erythemotelangiectatic rosacea, and this is when individuals have just extra redness on the skin. It may be permanently red, or they may just get flushing a lot more easy in warm or stressful situations. And that plays into quality of life a huge deal if you're trying to avoid those situations or triggers where it might cause you to flush. The second type of rosacea is papulopustular rosacea. This is where you tend to get pimples that look like acne, and so we actually call this acne rosacea. And this is sometimes a little more manageable, but when we successfully treat papulopustular rosacea, sometimes it shows that you actually have erythemotelangiectatic rosacea underneath, and we're going to talk about treatments for both. And the third type of rosacea, thankfully it's a little more rare, is phymatous rosacea, because this one can be disfiguring. And this is where the inflammation in the skin is so intense that it actually causes structures on your face to grow. There's a famous actor from way back in the day named W.C. Fields, and if you are of the generation where you watched his shows, you know that over the course of his career, his nose grew like Pinocchio because he had phymatous rosacea. And the nose is the most common piece of the face that will grow, but this can also happen on the forehead, it can happen on the ears, it can happen on the jaw, and there's an intense amount of inflammation. And if you guys want to see some amazing transformations on phymatous rosacea, then you should definitely watch some of the surgical procedures done by Dr. Pimple Popper, because she transforms people's lives with this. So those are the 3 main types of rosacea. There's the redness, there's the pimples, and there's the growing tissues of the face. Now there are other types of rashes that are kind of in the category of rosacea, perioral dermatitis being the most common one. We're not really going to dive into that today, but we're going to focus on basic in and out of rosacea. And I do want to touch on the quality of life issues that rosacea brings up for people, because it usually occurs on the face, so there's a lot of visible symptoms. And when you have something that makes you self-conscious about the way that you look, it can impact the way that you feel on the inside. You're less likely to display that confidence, whether it's at work, whether it's at social gatherings, and some people may even avoid social situations because of lack of confidence in their appearance. Another impact that rosacea has on quality of life is sensitivity to triggers. If you have rosacea, you may have noticed that certain things will cause you to flare. Some of these are foods that you might enjoy or drinks that you might enjoy. Some of the most common triggers for individuals with rosacea are going to be spicy foods, hot drinks, alcohol, chocolate, caffeine, coffee. And if you enjoy those things, and to be honest, most of those are pretty enjoyable, then you have to cut those out, and that's going to have a negative impact on your quality of life. All of these play into an impact on your social life. If you're worried about having a flushing episode, you may avoid going to family gatherings or other social situations, and then you start to withdraw from society a little bit. And I have patients that come in and they're so lacking confidence in their appearance that they don't even want to make eye contact with me. And when we can successfully treat them and watch them come back to the clinic and they've got a smile on their face and they look you in the eye, it's one of the most rewarding things. And so if you do struggle with rosacea, I want to give you hope that there are things that can be done. One of the other challenges with rosacea is difficulty in treatment, and if you've had it for a while, you've probably tried tons and tons of skincare, which kind of leads into another one of the problems, that it can be expensive to try to find the right solution. And maybe you buy a skincare product and it burns your skin, because physical discomfort is another part of rosacea, where your skin may itch, burn, you may get pimples that are just painful. And all of this feeds into just the emotional stress of having a condition that you can't manage. Most of us, I know at least I do, I like to have control over what's going on. And when you feel like you don't have control over your skin, it just compounds every one of the other problems that we have been talking about. So now that we understand the background of the types of rosacea and some of the factors that go on in a person's life, let's talk about some of the ways I approach treatment with my patients in the dermatology clinic if they come in with rosacea. Now, ultimately, I truly believe that rosacea is a compromised skin barrier. We've got inflammation, we get increased blood flow to the skin, and you're gonna have more water loss through the skin, and you have a compromised skin barrier. And that's why when you put on products, sometimes you're gonna notice that it burns or that it stings. So when we approach skincare for patients with rosacea, we really want to focus on very gentle products that are not going to strip the skin of oil, that are not going to cause increased water loss, and that are not going to burn or sting when you put them on the skin. I always recommend to start with a very gentle cleanser, and if you're super sensitive, you may only use a cleanser once a day, and that's totally okay. But if you just splash with water in the morning and that's the best that you can do, it's really a good start. But when you're looking for a gentle cleanser, you want something that probably isn't a foaming cleanser. It's okay if the cleanser foams, but not like a foam, if that makes sense. Also, gel-based cleansers tend to be a little more drying, a little more marketed for people with oily skin, and so I generally recommend that my patients stay away from gel cleansers or foam cleansers. Among the gentle cleansers that I'm a big fan of is going to be the CeraVe Hydrating Cleanser, the Cetaphil Gentle Fragrance-Free Cleanser. Those are really good options, and a brand that I don't think a lot of people may appreciate or recognize is Vanicream. Vanicream has some really good treatment options as well. So you want to go super gentle on the cleanser that's just going to remove excess dirt, oil, makeup from the skin. You don't want to scrub harshly, and I strongly recommend that you don't use tools like loofah scrubbers or anything like that on the face, because I promise it's just going to lead to more irritation. After cleansing, what else do you need in your skincare routine? Well, we want to avoid things like retinol in general, avoid benzoyl peroxide, avoid salicylic acid serums, avoid anything that is exfoliating, because we want to leave as much as we can on the skin to repair your moisture barrier. I do think that some people can do well with a hyaluronic acid serum. You just want a high quality one. I'll leave some recommendations down in the video description, right down there. And this is just something you want to make sure doesn't burn or sting your skin when you put it on, but putting that extra layer of moisture on with hyaluronic acid can sometimes be helpful to help repair the skin barrier. And then I want you to follow that up with a really good thick moisturizing cream, because we want to hold in as much of that moisture as we can, and we don't want that water loss going on. So a thicker cream-based moisturizer is generally going to do better for individuals with rosacea. I'm going to give you two recommendations that I absolutely love for individuals with rosacea-prone skin, and the first is Cicaplast. This is from La Roche-Posay. It is a very healing cream for the face. It's very thick, so you have to get used to that. This is what I put on my face after I laser it, and my skin barrier is completely trashed, and I'm trying to get that to recover as I recover from the laser. Cicaplast is a phenomenal moisturizer, and if you haven't tried it, you're going to love it. And if you need a moisturizer for the daytime or a moisturizer and sunscreen, I strongly recommend Cicapair. This is from Dr. Jart. It's a moisturizer and sunscreen that's specifically made for individuals with redness on the skin, because it has a little bit of color correction in it, which if you have excess redness in the skin, getting something with a little bit of a green tint to it will help to neutralize the appearance of that redness. And that's what the Dr. Jart products have in it with that Cicapair. So I'll link those again right down there in the video description, and these are really good options to try. And I do want to touch a little bit more on sunscreen, because when we talk about triggers for rosacea, UV exposure is a huge one. You don't want to be going out without sunscreen on the face, and typically you want a mineral-based sunscreen, zinc or titanium, that's going to help to block those UV rays and absorb that and not let it get down into your skin, because it will degrade your collagen and it will increase the risk of flares. Again, this is an inflammatory condition, and so anything that's starting to damage your skin is going to increase the production of new blood vessels. It's going to increase that inflammatory cascade, and we want to put a stop to that before it leads to more damage. So Cicapair and Cicaplast, great options for individuals with rosacea. That's going to help to correct the redness. It's going to help limit the inflammation from continuing and allowing this problem to get worse. Now, I want to work backwards in the treatment of these. We're going to start with phymatous rosacea. Again, it's rare, so we'll just touch on it a little bit. If you have phymatous rosacea and you can catch it early, this is an excellent treatment with prescriptions of a low-dose antibiotic like doxycycline. The biggest risk here is sun sensitivity and an upset stomach, so talk to your doctor about how to mitigate those risks. But it can really help to limit the inflammation in the skin and keep that problem from getting worse. Unfortunately, if you've experienced a lot of phymatous rosacea, you have lobules growing off your nose, your chin, your ears, wherever it is, this ultimately becomes a surgical problem because you've actually formed new tissue in the skin and you can't take that away with a pill or a cream. There are people that specialize in this, so you have to do some internet searching to find somebody like Dr. Sandra Lee that does this procedure regularly. There is an art to it because you want to remove that excess tissue while leaving the right structure and shape to the nose or whatever else the structure might be. As we continue to work back, let's talk about papulopustular rosacea. This is the acne type where you get the pimples and the bumps and the lumps. This is more often to be painful, and so this is where we may treat it in some ways like acne. I often will prescribe a low-dose antibiotic. Again, doxycycline is usually my go-to in these patients. Low dose, not high enough to start killing all the bacteria in their body or contributing to antibiotic resistance, because we all know we want to avoid that. And when you're on a low enough dose, it's pretty safe to stay on that for a long time. And we will always combine that with topical therapy. The most common topical therapy for papulopustular rosacea is going to be metronidazole cream or gel. I tend to prefer the cream in my patients because it's better for their skin barrier. I've prescribed the gel. Some people absolutely love it, but again, it's a gel. It's going to be a little bit more drying, and I have patients that will sometimes complain about burning. So typically, if their insurance will cover it, we go to the cream. And then there are additional treatment options, prescription topical is azelaic acid. There is over-the-counter versions of this at lower percentages, but we go 15% or higher by prescription. This helps to mitigate some of the inflammation in the skin. And then another one is ivermectin. Yep, ivermectin, the COVID controversy drug, has been around forever, and it has some anti-inflammatory properties, and it can be good in a topical cream. It's marketed under the brand name of Soolantra, but most dermatologists can work with a compounding pharmacy to make a version that's similar but not quite the same. We'll do a good job and generally at a much better price. And let me tell you what my favorite thing to do is for patients with papulopustular rosacea is to give them all three of those, but I don't give it to them as 3 different tubes of cream, but we just have the compounding pharmacy make it and put metronidazole, azelaic acid, and ivermectin all in the same tube so that they can do 1 application a day, get 3 highly effective medications that are going to help to control that inflammation. In rare circumstances, if the doxycycline and the topical creams are not helpful for papulopustular rosacea or for phymatous rosacea, we may occasionally use a low-dose Accutane, and Accutane is a completely separate conversation. We're not going to dive into the ins and outs of Accutane. I talked about it a little bit on a previous video. You can watch it up here if you want to check out some of the interesting information on Accutane in the treatment of acne. A lot of the risks and warnings will apply if you're on it for rosacea. Now let's get into erythemotelangiectatic rosacea, because I am sorry, this is the most difficult type of rosacea to deal with because you have had inflammation in the skin and you just have redness. There's no pimples to treat, and when you actually form new blood vessels, they are there permanently. A lot of the times we can treat these patients with a topical prescription, maybe the triple cream that I previously mentioned, but the goal here is not necessarily to get rid of the redness, but really to control the inflammation so it doesn't get worse. If we can catch a patient early enough in their course of rosacea and we can keep it from getting worse, they're often very happy with that. They can conceal a little bit of redness with makeup. For the women that suffer from this condition, men, they just tolerate it a little better. They're less concerned in general about their appearance. But if they have a public-facing job, if they are an executive or something where the appearances really matter to them, then we have to start looking into laser treatments, because the reality is when you've formed new blood vessels all over in the skin, around the nose, across the cheeks, those are there to stay unless we laser them. And we use a pulse dye laser or an IPL or BBL device to go in and actually zap those blood vessels and get them to go away. And I'm telling you, the results on this can be so satisfying because even with a single treatment, we can eliminate so many of those blood vessels. If you can see them and target them, they just boom, gone right away. If you kind of have more just that background redness and you can't see distinct blood vessels, it might take more than one treatment with the laser in order to get your complexion where you want to be. But I can't stress enough that it is still important, even if you're going through laser treatment to correct that redness, that you need to be on topical therapy at least to help limit the inflammation and keep this problem from coming back. Now, there are so many other things that we could dive into for rosacea, but I'm very curious to know what your questions are on this topic because that'll kind of guide our next conversation when you come back to the channel. And we're going to talk about potentially diet and rosacea. We're going to talk about skin inflammation. There's a lot of different angles that we can take on over-the-counter, outside the doctor office treatments or inside the doctor office treatments. But I want to know what you're curious about. There's definitely, especially in women, a hormonal component. Many women don't experience this until they go through menopause. So there's so many factors that we could consider. But I'm hoping that we gave you a good kind of outline of the types of rosacea, the ways that impact your day-to-day life and the stresses that can give to you, and give you an idea of treatment options both over the counter and in the clinic. And like I've always said, guys, thank you so much for watching the videos. And let me tell you that when you click on the links down in the video description, it helps support my mission of providing free dermatology care to as many people as possible. If you haven't seen the motorhome that we have purchased and redesigned, we are going to be going out and doing free skin cancer screenings to underserved communities, whether people don't have insurance or just have a hard time getting to a dermatologist. And I want to do that as much as possible, but to give away everything for free, I need your support, and I want you to get something out of that. I'm not asking you to just give me money, but if you buy products, look for them in the links or through my social media. It means the world to me to have your support, and I want to keep bringing you high quality information. Thank you so much for watching the video. I'll see you guys next time.